Good evening. Thank you, Professor Carraro, to invite me to this important symposium meeting on muscle research. My name is Giovanni Pegoraro. I'm a physiotherapist. I work in a neurological rehabilitation center near Varese, and I want to share you some insights about electrostimulation in spastic patient. And after a stroke, a patient has an hemiplegia. Hemiplegia is a mixture of some symptoms like loss of sensibility, weakness, and spasticity. Spasticity is the great enemy of functional restore of mobility, because it is an increase of stretch reflex and is velocity dependent, and it give a stiffness of joint, and a patient is very impaired to have movement. And this is the typical pattern of movement of lower limb of the patient. As you see, the spasticity of plantar muscle provide an extension of the knee, and this provides the typical pattern of the extension of the limb. And as you can see, in the Gait analysis, the approach of the foot on the ground produce a posterior vector, and to compensate the posterior push, the pelvis and the hip need to be in flexion. It's for this reason that we have in all pattern, all cycle of Gait analysis, the pelagic hip is in flexion, instead the other is in flexion and in extension. This is not really pathologic. It is not given by pathology, but sometimes and often is a compensation. So we decide to stimulate the extensor hip muscle of the hemiplegic patient to see if we can restore a good and a proper push of the hip on the ground. But we know electrostimulation is always a controversial issue, because of someone thinks that can get worse the spasticity, and so we don't stimulate the spastic muscle. We don't stimulate the antagonist of spastic muscle, but we just stimulate weak muscles. And so we stimulate the extensor hip muscle, but we have some problem, because instead of quadriceps is very easy to stimulate. The gluteus zone is particular because we have the thickness of fat, and the sensibility sometimes give an unconfident stimulation. Patient hurts, it's an impulse that can hurt in the region. So we decided to apply the electrodes near the trochanter and on the iliac bone. And we choose a stimulation 100 Hertz and 70 microseconds in combination with the 2 Hertz and 16 microseconds. I choose always a stimulation in a low frequency, because I like to enhance the intensity. I use the low frequency to get more intensity, and the intensity that we use is just to observe a good quality of contraction, but to avoid an irradiation of spastic muscle. We don't need to stimulate a spastic muscle. And we use always in a functional position, in a standing position, once a day for 30 days. And in the first trial, we stimulate all patients without botulinum toxin injection. And at the end, after 1 month, we didn't see a good result, but compared from the control group, and so we asked to ourselves why there is not a significant improvement after that. The reason is because the spasticity of plantar muscle continues. Don't allow the activity of the extensor muscle. So when we make an inhibition of plantar muscle with the botulinum toxin, so in the second trial, we stimulated the extensor hip muscle after injection of botulinum toxin in the plantar flexor muscle. Botulinum toxin is a drug that can decrease the spasticity. So we were surprised because we observed our improvement of velocity on speed of walking patient. This is the test of 10 meters. As you see, we see an improvement of velocity after the stimulation of the extensor hip after the injection of botulinum toxin. And this, in conclusion, this is before the trial. Okay, as you see, the approach of the foot in a tip-to touch produce an extension of the knee and a compensation with the hip. And so here, the pelagic limb, the pelagic hip is always in flexion, little bit extended, and there is no absorption and restore and push in the extensor limb. And after the period of stimulation, you see is the walking is more fluent, it improved a lot, and the patient restored the normal extension of the hip, and the muscle, the extensor hip can absorb the force and push the power and the strength on the floor. Then, in conclusion, we are fan of electrostimulation, but for the spasticity, we have always to think what to gain, what to get. And I think that is interesting. It's a very powerful tool, but always thinking what to gain, what to get after stimulation is always in a project of rehabilitation. Thank you for the attention.